So I'm going to go ahead and do a quick introduction to Let's Recover, to Nick Giulino and Peter Prasada. They are a technology-facing company. They provide outpatient M.A.T services and one-to-one psychiatric counseling. They're an awesome solution for so many of us where our patients have issues of transportation, childcare. They might be in a remote area where getting to a location is difficult. This really, their service really fills in the gaps for so many people who just normally wouldn't have any access to care. I hear it every day from everyone that we work with. We're nearly 600 users strong today. And I hear it every day. Transportation is the big, huge barrier. So Let's Recover is offering an opportunity for patients to have a treatment scenario just like this, where they talk to someone online, they're able to get their prescriptions prescribed online, and really participate in navigating themselves towards a healthier, better future, which is the work that all of us are doing every single day. So I'll hand it over to Nick and Peter to take over the conversation and present to you guys. Just so you know, both of you, if you can drop contact information here at some point in the meeting, so people can copy and paste it. You can reach out to them directly. And of course, you can always find their services on the RecoverWell platform. You can apply directly to their services there. That way you can transmit all of the important patient information securely through our platform. You can call them directly. And yeah, without further ado, I'm super proud to be working with you guys and really glad that you can bring the service to more people.
Yeah, thank you so much for the wonderful introduction. And yeah, I want to say thank you to everybody for joining. I know how busy it can get. I'm going to run through just a quick PowerPoint presentation. I'll keep it pretty brief, and then we can just open it up to questions from there. Just going to give a quick overview of who we are, what we do. Sorry, actually, I doesn't look like I can share my screen right now. Do you mind giving me access?
Hey, Amy. Yeah, I think we're both, unfortunately. Oh, you're working on it. Gotcha.
Yeah, you got it. You got it.
Yeah.
Sorry, guys. I got to turn off my video and my sound so that I don't disrupt you.
You're
awesome.
Good.
Thank you.
Thank you so much. And yeah, so as kind of introduced, my name is Nick. I'm the CEO here at Recover, and we also have Pete Posada on the call. He is the head of partnerships, so leads up our kind of outreach efforts with the California Bridge program and emergency rooms, among our other partners. In terms of Let's Recover, we're a substance use treatment provider currently contracted with Solano and 19 other counties in California. We also work with most major insurance plans, both commercial and Medi-Cal, to provide our services. There's a little bit of distinction across those services, so I'll just ask you to kind of keep that in mind of the counties and the insurance companies. Some of you might be aware of those distinctions, but I'm just going to kind of provide a quick overview of the services that we do provide. So our program, as mentioned by Amy, is offered fully via telehealth, so 100% remotely. What that means is we treat patients throughout California via phone, computer, or tablet, really anything with an internet connection. We can provide services. Our three primary services are medication-assisted treatment. So we have options for opioids, alcohol, and actually just finished a stimulant use M.A.T program pilot with Sacramento. So we offer stimulant options as well. And then we also treat co-occurring psychiatric conditions. So any basically mild to moderate, so non-crisis psychiatric services, we also have that expertise in-house. In addition to our medical care, we provide counseling and therapy, and also finally case management. So this is kind of ongoing case management. And I'll just give a little bit more information about each of those in turn. The main thing I just wanted to call out is, as I mentioned, we're contracted with 20 counties, and I'm actually going to ask Pete, do you mind dropping those counties in the chat just so everyone has them?
Will do.
Awesome, thank you. Yeah, to avoid the listing them out, but the main distinction in our counties is, you know, we provide our MAT services, like I said, if we're in network for insurance. The counseling and case management is generally going to flow through places where we're partnered with the county. So anywhere in those counties, anyone with Medi-Cal, we can provide full suite of services. Elsewhere, we focus a little bit more on that. So on the medical care component, as I mentioned, two big components here. The first is medication-assisted treatments for substance use disorders. So like I said, for opium, morphine. We also have options for sublocade injections for folks who want more long-acting care. On the alcohol side, frontline is usually going to be a naltrexone or a Vivitrol injection. We also occasionally use a compressate as clinically indicated. And then lastly, for stimulant use disorder, there was a study that was conducted by NIDA, the NIH, that found about a 4x improvement in patients who are co-prescribed Wellbutrin or bupropion and naltrexone for moderate to severe stimulant use. So we also have been leveraging that with a number of our counties. It's something some of you may have heard about, but I'd like to call out just for anyone who's got a stimulant user, as I think, as we all know, that can be a difficult population to treat. In addition to our medication options for substance use disorders, as I mentioned, we also provide psychiatric care. This is, you know, as needed, right? So the majority of our patients have psychiatric co-occurring conditions, but we provide that medication management in tandem with MAT. So it's not, you know, an additional appointment or additional provider. All of our MAT providers are also psychiatrically trained. So they'll do a full psychiatric eval as they're evaluating patients for MAT. Next, on our kind of counseling programs, all of our patients receive evidence-based counseling from master's levels counselors. Some of our methodologies include cognitive behavioral therapy, motivational enhancement therapy, motivational interviewing, and psychoeducational counseling. A couple things to note here. All of our services are modular. What that means is if somebody wants counseling and not MAT, we can do that. If they want MAT and not counseling, we can do that. So I didn't want to give the impression that these are required components of our program. We're a low threshold buprenorphine provider and low threshold MAT provider. So we make a point of basically meeting patients where they are, but this is a resource available to all our patients, but not necessarily required. Second, just to give a little bit more color to this counseling, we don't really have a cap on the number of hours per week. We can go up to 19 hours a week of counseling, depending on patient need. So
I did a stinging again.
Okay, not sure if that was for me, but just to kind of flesh that out a little bit, when we do an intake with a patient, we will basically explain the resources available to them. If they're interested in counseling, we'll come up with a plan that works for them, and then go from there. So up to 19 hours, and this is also available to adolescents. So we treat anyone basically 12 and up. Lastly, case management. So upon intake, all of our patients are assigned a dedicated case manager. These case managers can assist patients for they might need. So if they need a primary care appointment, we can help them get that scheduled. If they're looking to enroll in a vocational or educational program, looking for housing, if they're involved with the criminal justice system, anything really that they need help with, we can support them there. And they have a dedicated case manager who follows them throughout treatment with us. Lastly, just to kind of give everyone a sense of what this looks like, you know, again, when someone comes to our program, we'll schedule them a medical appointment and an initial assessment with a counselor. If they're opting into counseling, that'll be a medical and a therapeutic, basically, assessment in tandem. And then that will then be communicated to their case manager. So they have essentially a full treatment team delivered remotely through us. And I'll talk about tactically what that looks like in a second. So in terms of who to refer to us, as I mentioned, we treat adults and adolescents with a substance use disorder, or for adolescents, people who are at risk of developing a substance use disorder. We are also a perinatal treatment provider. So if you have a perinatal patient, we provide those services. And then we also generally say that, folks need to have internet access. I will say one question that I get quite a bit, particularly from folks working in emergency rooms, is around people experiencing homelessness. And so for that, I do want to call out over 10% of our patients are currently unhoused. About 83% of unhoused folks have devices. So that is not it's a barrier to treatment, but does not rule people out. So just wanted to kind of call that out because it's quite a bit. In terms of our programs, we have outpatient, which is basically anything under 9 hours of counseling a week, intensive outpatient, which is anything over 9, under 19. As I mentioned, adolescent treatment programs. We also have fluent Spanish speakers on our team, kind of across the continuum of care there. Perinatal programs, justice involved specific programs, M.A.T only, and then also, as I mentioned, mental health on the therapy and counseling side and on the medications. Some things that kind of separate us out, and I like to just call this out, particularly for folks who might be in the emergency room. So we do same day enrollments and confirmations. What that means is Monday through Friday, if you call us, we'll do a live intake with a patient and get them scheduled. We do prioritize our emergency room patients because we know getting kind of quick be a challenge. So we'll do those same day intakes. In terms of appointment schedules, basically initial appointments within 48 hours to 2 business days. I will generally say that the one thing that we do ask is, Friday afternoons can be a little bit challenging. So if you have a Friday afternoon patient, just shoot us an email and let us know, and we'll work with you on making sure they get in as quickly as possible. As I mentioned, we do have bilingual services and non-English services. So translation services for anything other than Spanish, native Spanish speakers on staff, and then expertise across a number of populations. So whether it's, LGBTQ+, native, unhoused, veterans, justice involved, really anything that you might come across, we've probably come across before. And lastly, we do focus on Medi-Cal, but we have a number of commercial plans as needed. One of the other things I hear quite a bit from our emergency room folks is challenges with underinsured folks, people who might have commercial insurance, but who don't have great benefits. So we do work with those people as well as needed. In terms of how to refer, as Amy said, we are on the Recover Well platform, so that's an easy, secure way to refer to us. We also have a secure referral form that's located at www.letsrecover.com/referral.
Oh my God, who is on my team?
You can also, if you go to that website, just click referral, take you right there. Our phone line is also available. That's 858-221. And you can also email Pete or me at any time or fax us. Lastly, just before I turn it over to questions, and the patients can also contact us directly themselves at that same phone number or through our website. What I was going to say was, before I turn it over to questions, just to give you a quick sense of what this might look like in your day-to-day. Let's say a patient reports to the emergency room looking for medication-assisted treatment. You have one or two options. If, depending on your workflow, if they have to get basically seen by a medical provider first, we also can people can call us while they're in the waiting room if they like to. If there's a long wait, they can give us a call and try to get them scheduled preemptively. If you're kind of working with them once they've been admitted, you can call live or have them call us. So if that happened right now, we basically do a quick intake. It takes about 15 minutes. We would explain the program to them, get their insurance information, and then some demographic information. Once that's completed, we would get them scheduled. As I said, we offer them an appointment as quickly as possible, no later than 2 business days, same day or next day. And then they would get a link texted to them an hour before and emailed to them 24 hours before. They just click that link, takes them right into their appointment. They see a provider and would call a medication either into a local pharmacy or they can have it delivered to them, depending on what's easiest for the patient. Anyway, I will pause there. Happy to answer any questions y'all might have, and thank you again for your time.
Yeah, I wanted to say to everyone that you guys are planning to have more availability in Southern California very soon. Can you elaborate on that so that we know when we'll start seeing you providing services to our SoCal clinicians?
Yeah, so it's unfortunately out of my hands. We basically work with at the speed of government, as I like to say. So we've been working with a number of the counties in Southern California. I live in San Diego. We have a licensed facility there. So it's very close to my heart, literally and metaphorically. I'd say I'm hopeful, and hold me to this, give us about 3 months. And then ideally, almost certainly by end of year, again, barring anything unforeseen. But Amy, we'll let you know as soon as we're picking up in Southern California.
Okay, and I'll send out a notification to everybody to let them know once we're activated with Let's Recover in SoCal. Someone's asking about Tulum County.
Yeah. So I think that was Tuolumne, right? Yeah. So we would be in network on the insurance side. We actually worked with them. They were one of our first programs through a grant program back in 2021. So I'm pretty familiar with the landscape. We are not currently contracted with the county, but if you have a kind of particular need on the M.A.T side, happy to connect.
Okay, anybody else have questions? Okay, I'm going to do our drawing here and draw a name for our Amazon gift card. And then for everybody who's here, I will be sending out, or Aya will be sending out an email in the next couple of days with a recording from this video. So you can, anything that you missed, you'll be able to see there, and we'll send it out to everybody else who didn't get a chance to attend. And the number's right there. If you need to reach out to these guys and find out more information, please do so. I encourage you to utilize Let's Recover. It's an awesome program, especially we do get clients down here in Los Angeles that are from Northern California. They made their way down here. They've got NorCal insurance. You can use it for those patients as well. And yeah, so please use it. You can find them on RecoverWell, call them directly, but utilize it. It's a great new program. I'm really happy about it. Okay, our winner is Lupe Morehouse. Are you here, Lupe? I see you. In case you, oh, yay. Okay, she sees this. So Lupe, I will send you your $50 Amazon gift card. I hope you guys keep coming to these great meetings and learning more about the awesome providers in our network. Thank you, Peter and Nick. And we really appreciate you giving us such a good in-depth look at the services that you're providing. And I hope that everybody will make contact with you over the next few weeks and start building a relationship with you. Thank you very much. Everybody have a fantastic weekend. Yay.